Hello, welcome to Chapter 10, the nervous system and mental health. So today we're going to look through many of the words that deal with the nervous system and mental health. We'll work on spelling and pronunciation as well as different abbreviations that are approved throughout the medical community. So let's get started on the structure and function of that nervous system. So our nervous system is divided into two main sections. We have our central nervous system, which is made up of that spinal cord, and that brain. And then we have the peripheral nervous system. That peripheral nervous system is all the nerves that come off of the spinal cord and the ones that come off of the brain. We have spinal nerves. Those are the ones that come directly off that spinal cord. We have 31 pairs of spinal nerves. And then cranial nerves are the nerves that come directly off the brain. We have 12 pairs of cranial nerves. So that peripheral nervous system can be further divided out. It can be divided into a sensory and a motor division. So the sensory division of the peripheral nervous system consists of visceral nerves and somatic nerves. In this sensory division, sensory nerves, or afferent nerves, afferent for going into the brain, carry messages towards the spinal cord and the brain from sense organs, like the eyes, ears, nose. The visceral nerves carry signals from the viscera in the thoracic and the abdominal cavities, like the heart, the lungs, the stomach, the intestines, the urinary system, the reproductive systems. All of that information is coming from that visceral. And then that somatic carries signals from the skin, muscles, bones, and joints to the brain. And then we have our motor division. This is what carries information away from the brain. It's carrying information to muscles and organs. So in this motor division, these motor nerves, or efferent for away nerves, carry the messages away from that brain. We also have an autonomic nervous system within this peripheral nervous system. The autonomic is going to carry signals to glands, cardiac muscle, and smooth muscle. This operates on a subconscious level. This is stuff that we do not have control over. Somatic motor division carries signals directly to those skeletal muscles, and it's under voluntary control. Involuntary means that something functions without us telling it to happen. Like you can't tell your heart how fast to beat. You can't tell your digestive tract how fast to move something through it. So that is involuntary. So there's an acronym for remembering the different parts of the nervous system. That acronym is SAME. Sensory nerves are afferent nerves. Motor nerves are efferent nerves. So sensory, afferent is going into the brain from those senses. Motor, efferent, is going away from the brain. And that autonomic nervous system can be split out into two divisions as well. That autonomic provides motor control to organs that function automatically. We have that sympathetic division of that autonomic nervous system. That is that fight or flight type of response. So it increases the heart rate, increases respiratory rate. It dilates those respiratory pathways, so it makes it easier to breathe. It increases oxygen supply to your tissues, your brain, your muscles. This happens in times of stress even. Then we have our parasympathetic division of that autonomic nervous system. This parasympathetic is that rest and digest. So this is functions that happen to calm the body, like slow down your heart rate. But it stimulates digestion. It stimulates filtering your blood to get rid of more wastes. That sympathetic slows down your kidneys from filtering blood. That parasympathetic will increase it. Sympathetic slows down your digestion, while parasympathetic increases it. Why? During a fight or flight response, you're trying to want to run away from something. The last thing you want to have to do is stop to go to the toilet. So we slow those down in times of stress. So let's look at some of the functions of the nervous system. Sensory input to the brain comes from receptors all over the body at both the conscious and subconscious levels. Internal homeostatic stimuli are being processed continually at that subconscious level. Motor output from the brain stimulates the skeletal muscles to contract and enables a person to move in any way. The production of sweat, saliva, digestive enzymes is controlled without active input from you. Evaluation and integration occur in the brain and spinal cord to process the sensory input, initiate a response, and store the event in memory. Homeostasis is maintained by the nervous system taking in internal sensory input and responding to it. And mental activity occurs in the brain so that a person can think, feel, understand, respond, and remember. So let's look at these roots here. Let's do some defining of words. Nerve means nerve. Sense means to feel. Surge means to operate. Epilept means seizure. And then we have nerve, which means nerve. So neuro, like neurology, neurologist, sense, sensory, surge, surgeon, surgery. Epilept, like epileptic, epilepsy, anti-antileptic. Nerve, like electroencephalogram. So let's look at the word neurologic. Our root is, or combining form is neuro, which means nerve. Log means to study. Ic means pertaining to. Electroencephalograph, almost like graph. Electricity. Encephalo, brain. Graph, to write or record. And then we have electroneurodiagnostic. Electricity, Neuro, nerve. Diagnost means decision. Ic means pertaining to. So let's go through some abbreviations here. We have CNS, Central Nervous System. PNS, Peripheral Nervous System. ANS, Autonomic Nervous System. Perfect. Okay, so let's look at the Latin and Greek words here. Afferent means to bring to, while efferent means to bring away from. Neuron is actually the Greek word for nerve. So neurons, or nerve cells, they are the main cell of communication cell of the nervous system. They're going to receive stimuli and transmit impulses to other neurons or to receptors in other organs. Each neuron consists of a cell body and in two types of processes or extensions called an axon and dendrites. Axons are short, multiple, highly branched extensions of the neuron cell body. They conduct impulses towards the cell body. Bundles of these axons appear white and create the white matter of the brain and spinal cord. Neuron cell bodies, dendrites, and the synapses appear gray and create the gray matter. So let's look at some more words here. Myelin. We look at mile means spinal cord. And then we have in. This is going to mean substance or chemical compound. So this is a material of the sheath that wraps around the axon of a nerve. Synapse. Syn means together, and then apse is going to mean clasp. So this is the junction between two nerve cells. The synapse is the space between the axon of one neuron and the dendrite of another neuron, or the space between a neuron and an effector cell. Neuroglia. Neuro is that combining form for nerve, and glia means glue. So this is connective tissue holding nervous tissue together. And then we have neurotransmitter. Neuro means nerve. Trans means across. Mit means send. And is that agent. So the chemicals which assist or inhibit the transmission of stimulus across a synapse. There are different types of neurotransmitters, and which make up different chemicals and they all have different functions. Norepinephrine stimulates many areas of the central nervous system. Its effects are similar to cocaine and amphetamines. Serotonin stimulates many areas in the central nervous system and is usually involved in mood, anxiety, and sleep. Dopamine inhibits excessive muscular activity. So let's look at the meaning of these words. Axon. Axon is Greek. It's for axis. So this is a single process of a nerve cell carrying nerve impulses away from a cell body. Dendrite is Greek for looking like a tree. So it's a branched extension of a nerve cell body that receives nervous stimuli. Glia means glue. So it's that connective tissue that holds a structure together. So let's look at the brain and the cranial nerves in more detail. So our brain is divided into three portions. We have the cerebrum, which is the largest portion of the brain. It consists of two halves or two hemispheres. The cerebellum is a smaller portion of the brain that lies below that cerebrum, and it coordinates skeletal muscle activity to maintain posture and balance. And then there's the brain stem, which is an elongated portion of the brain that lies below that cerebrum in front of that cerebellum. That brainstem connects the brain and spinal cord. So within the cerebrum, those two hemispheres are split up into four separate lobes. We have the frontal lobe, which is located behind the forehead, that frontal bone of the skull. It is responsible for memory, intellect, concentration, problem solving, emotions, and the planning and execution of behavior. The parietal lobe, it's located above the ear. It is responsible for receiving and interpreting sensations of pain, pressure, touch, temperature, and body part awareness. That temporal lobe, which is behind that ear, is responsible for interpreting sensory experiences, sound, and spoken word. The occipital lobe, the back of your cerebrum, is located at the back of the head. It is responsible for interpreting visual images and the written word. So there's different areas within the cerebrum that have different functions. Within this kind of within the cerebral hemisphere, kind of goes down into the brainstem, there's these open spaces that are known as ventricles. Ventricles make and contain this watery fluid called cerebrospinal fluid. The cerebrospinal fluid circulates through the ventricles and around the brain and spinal cord. It helps to protect the brain, cushion the brain, and provide nutrients for the brain and spinal cord. Your brain actually floats in that cerebrospinal fluid. Underneath the cerebral hemispheres and ventricles are the thalamus and that hypothalamus. The thalamus receives all sensory impulses, and it's going to channel them to the appropriate region of the cortex for interpretation. While that hypothalamus is going to help regulate your blood pressure, body temperature, water, and electrolyte balance. So whenever you feel thirsty, that's your hypothalamus telling you to drink. Our brainstem relays sensory impulses from the peripheral nerves to the higher centers of the brain. It also controls vital cardiovascular and respiratory activities. That brainstem is what make sure that you're breathing at all times. Make sure your heart is pumping at all times. That cerebellum that sits posterior to that brainstem and below this cerebrum, it coordinates your skeletal muscle activity to maintain the body's posture and balance. A fun little tip about that cerebellum, if you've ever seen somebody who is drunk, alcohol inhibits the cerebellum. So it's you can see how much the cerebellum does for your coordination and your balance by watching somebody who is drunk, because they lose their coordination, they lose their balance. They don't have any of that because that cerebellum is inhibited and cannot provide that input to their movement, which is also why being able to walk in a straight line is one of those tests that they use for drunk driving. Being able to touch your finger to your nose with your eyes closed is another one of those tests for the cerebellum. It's from the cerebellum, testing that coordination, because again, that cerebellum is inhibited. So cerebrum means brain. Gyrus means circle, and it is a round elevation on the surface of the cerebral hemisphere. Gyrus is, the plural of gyrus is gyri. Pons. Pons is Latin for bridge. This is part of the brain stem. There's 3 different parts to that brain stem. Sulcus means furrow or ditch, and it is a groove on the surface of the cerebral hemisphere. A sulcus separates one gyrus from another. The plural of sulcus is sulci. And then thalamus. Thalamus means inner room. So it is a mass of gray matter under the ventricle in each cerebral hemisphere. The brain communicates with the rest of the body through cranial nerves and the spinal cord. So cranial nerves are part of the peripheral nervous system and originate from the inferior surface of the brain. They have both names and numbers. So there's mnemonics. There's a lot of mnemonics. This is just one of them. You can Google mnemonics or cranial nerve mnemonics, and you'll see this one, you'll see several other ones, you'll see some inappropriate ones, but for some people, that's how their brain remembers things. Whatever works for you. So, oh, once one takes the anatomy final, very good vacations are heavenly. This is a mnemonic for these cranial nerves. So we can go through the different cranial nerves here. 1, olfactory. Smell. 2, optic. Vision. 3, oculomotor. 4, trochlear. 3, 4, oculomotor, trochlear. Only 5 there for a minute. 6 is abducens. 3, 4, and 6 are the muscles that allow your eyeballs to move around. So you can look at something to the left, to the right, above, below, down and out, up and in. Those 3 cranial nerves move your eyes about. 5 is trigeminal. This gives sensory to your face, so you can feel when something's touching your face. It also gives motor if you clench your teeth down, that's trigeminal nerve doing that. 7 is facial. So this is the one that lets you make facial expressions. It also does some taste to the back of the tongue. 8 is vestibulo-cochlear, hearing and balance. 9 glossopharyngeal. Your gag reflex comes from here. Sensory in the mouth. 10 is vagus nerve. This is a lot of autonomic functions to your heart, your lungs, your digestive tract. 11, accessory. This is what lets you move your head, the muscles that connect to your neck. Accessory nerve goes to, so you can move your head around. And 12, hypoglossal. It would come to me in a second. This is what lets you move your tongue around, is this one. Vagus will give some taste, facial gives some taste. Glossopharyngeal, I think, is the other one that does some taste to your mouth. So 3 of them allow you to taste food that you're eating. So onto the spinal cord. Our spinal cord has the same regions as the spinal column did. So your cervical nerves are going to go to your neck, your shoulders, and your arm. We also have a nerve in here that goes to your diaphragm that lets you breathe. Comes out of the cervical nerves. Thoracic nerves allow you to move your arms. Upper thoracic ones do. Lower cervical ones move your arms as well. The rest of the thoracic, the middle and lower thoracic, goes to the chest, the ribs, that vertebral column, your back muscles. Lumbar and sacral. Lumbar does hips and down the front of the legs. Sacral does back of the legs. The buttocks and the genital area for sacral as well. So surrounding both our brain and our spinal cord, we have meninges. These meninges, again, are also there to help protect, provide that cushion to your spinal cord and your brain. And also parts of it separate out that brain and that spinal cord, that brain into the different lobes. That dura mater is the outermost layer. The arachnoid is the middle layer. You can kind of see this spider web kind of appearance. That's part of that subarachnoid space. And then pia mater lies directly on top of the brain, that innermost layer, or directly on the spinal cord, one or the other. So let's go through these words here. Epidural. Epi means above. Dur means dura. And ul means pertaining to. So above the dura, the space in which local anesthetics can be given. An epidural will be given to people who, like pregnant women, when they're giving birth, if they choose to do it, it kind of numbs everything from that leg down, from that area down, so they don't feel that childbirth. Dura mater. Dura means hard. Mater means mother. So it's a hard, fibrous outer layer of the meninges. Arachnoid mater. Arachn is going to mean cobweb or spider. Mater again means mother. That oid means resembling. So this is that middle-like layer that resembles this web-like appearance. Pia matter. Pia means delicate. Matter means mother. So it's that delicate inner layer of the meninges. And then we have the subarachnoid space. Sub means under. Arachn means that cobweb spider appearance. Oid means resembling. And then space between the pia mater and the arachnoid mater. This is the area that contains cerebral spinal fluid. So this is it when they do a spinal tap, pull out cerebral spinal fluid to examine it for like meningitis. This is where they're going, that subarachnoid space. So I just said that cerebral spinal fluid, C1 to C8, are the 8 pairs of cervical spinal nerves. T1 to T10, these are the 10 pairs of thoracic spinal nerves. L1 to L5 are the 5 pairs of lumbar spinal nerves, and then S1 to S5 are the 5 pairs of sacral nerves. So disorders of the brain, cranial nerves and meninges, there's quite a few. So dementia. Dementia is a collection of signs and symptoms with many different causes. Some of these signs and symptoms: short-term memory loss, inability to solve problems, confusion, inappropriate behavior, impaired intellectual function. Some causes of dementia include reactions to medications, hypoglycemia, or other metabolic dysfunctions, vitamin deficiencies, infections in the brain, emotional problems like depression. Dementia can also occur after a stroke. So senile dementia is not a normal part of the aging process. This refers to a collection of symptoms that can be caused by a number of disorders affecting the brain. Alzheimer's disease is the most common form of dementia in which nerve cells in the brain are replaced by clumps of proteins. Vascular dementia occurs when the arteries supplying the brain with oxygenated blood become narrower or blocked. Frontotemporal dementia is caused by a progressive cell degeneration in the brain's frontal and temporal lobes, which control planning and judgment, emotions, speaking, understanding speech, and certain types of movement. Confusion is both a sign of dementia and delirium. So confusion is that inability to process information normally, while delirium is a sudden onset of disorientation, inability to think clearly, or inability to pay attention. This image here is showing, the yellow is showing specifically where there's atrophy in that brain, which is typical of Alzheimer's disease. Epilepsy is known as a seizure disorder. In epilepsy, a cluster of neurons sends out electrical signals in an abnormal rhythm and pattern. And they're usually nerves that are sending out this pattern of information that was not stimulated in the first place. Status epilepticus is having a continuous seizure or recurrent seizures without regaining consciousness for 30 minutes or more. Tourette syndrome is characterized by episodes of involuntary, rapid, repetitive, fixed movements in individual muscle groups. Tourette's can be verbal tics, they can be physical tics. And then there's narcolepsy. It is a chronic disorder in which the affected person falls asleep during the day with loss of muscle tone, brief episodes of total paralysis, and hallucinations. These people can fall asleep at any time and anywhere without realizing it. So let's look at some of these words here. So ICT is a root word for seizure. That AL this is a capitalized ICT. There we go. Means pertaining to. So ictal is pertaining to a condition caused by a stroke or epilepsy or a seizure. Post means after. So post-ictal is a transient neurologic defect after a seizure. These terms, grand mal, petit mal, and tonic-clonic seizure, are not used anymore. They have changed them. But for your textbook's sake, we'll look at these terms, but just know they like to change terms a lot in medical field. Everybody gets used to one term, these terms, grand mal, petit mal, tonic-clonic seizures, and then they change them. So a new group of students come out knowing completely different terms. So just know that these terms are terms that technically they're no longer used, but for the book's sake, we'll use them. Petit means small. So petit mal is a term for an absent seizure. What that means is that person may black out for a couple seconds when this seizure is happening. They have no recollection of what just happened. Grand is going to mean big. Mal means bad. So that grand mal is another term for that tonic-clonic seizure. That's the people that you're going to see, those muscles jerking. They usually fall over. They lose control of their entire body. And then those tonic-clonic seizures. This is that grand mal, which occurs with the body's alternates between excessive muscular rigidity, that tonic, and jerking muscular contractions, that clonic. And then we have atonic. A again means without. On means pressure or tension. Ic means pertaining to. So atonic means without normal muscle tone. Ischemic strokes or cerebral vascular accident. That's what we call a stroke. A stroke occurs when oxygenated blood supply to the brain is cut off. So strokes are also known as that cerebral vascular accident. Strokes are characterized by numbness, weakness, difficulty with walking, balance, or coordination, trouble speaking or understanding speech, difficulty with vision, dizziness, confusion, and severe headaches. Usually they're like a headache, like if people have never experienced before. A normal headache is not a sign of a stroke. It's a type of pain you've never felt before. An ischemic stroke is characterized by dead brain cells because of atherosclerosis and embolism or occlusion of a small cerebral artery. Like this picture right here is showing us an embolus blocking off blood supply. A hemorrhagic stroke occurs when a blood vessel breaks so that an aneurysm ruptures or arteriovenous malformation ruptures, so that blood leaks into that cranial cavity between the brain and that skull. And then a transischemic attack are like small strokes with short-term symptoms. So like this embolus that we see here, it may block this blood vessel, but there's enough pressure coming from behind it to push it forward to keep moving. So it may get lodged there for a minute or two and then it just keeps going. So these people may experience some symptoms, but they don't last. Parkinson's disease is thought to be caused by the degeneration of neurons in the basal ganglia that produce dopamine. Symptoms of Parkinson's are motor symptoms of abnormal movements, tremors, that shaking of the hands, rigidity, a shuffling gait, and a weak voice. Creutzfeldt-Jacobs disease. This is a rapid deterioration of mental function with difficulty in coordination of muscle movement. Some cases are linked with mad cow disease. This technically is the human version of mad cow disease. Syncope is the medical term for fainting or passing out. If somebody faints or passes out, the person should lie in a reclining position, not flat, reclining. Migraine produces an intense throbbing, pulsating pain in one area of the head, often with nausea and vomiting. It can be preceded by an aura, visual disturbances such as flashing lights, or temporary loss of vision. Prevention is difficult, according to your textbook. If you can figure out what's causing the migraines, they can be prevented. Some people get migraines from eating chocolate. Others will get migraines from drinking wine. There's a lot of different causes out there. Some very well-known causes that if you stop eating chocolate or stop drinking wine, it'll stop the migraines. Encephalitis is inflammation of brain cells and tissues. It is often viral in nature. Encephalitis is usually found in the elderly and children. A brain abscess is usually the result of the spread of infection from a sinusitis, so a sinus infection, otitis media, middle ear infection, or mastoiditis. The mastoid process, which is found behind the bone right behind the ear, has a bunch of air cells in there and they can get inflamed. Brain tumors have often metastasized from cancers in the lung, the breast, or the kidney. Primary brain tumors arise from glial cells, that connective tissue, and are called gliomas. How are brain tumors treated? Surgery, radiotherapy, chemotherapy, brachytherapy, depends on what they need. So aneurysm is a dilation, small, circumscribed dilation in an artery or a cardiac chamber. Carotid is a large neck artery, like the carotid artery. Me or hemi means half. Me, migraine, is a headache confined to one side or half of the head. Syncope is cutting short, like a temporary loss of consciousness and postural tone caused by diminished cerebral blood flow. Or not just blood flow, but not enough blood sugar, glucose either. Hypoglycemia can cause somebody to pass out. Tremor is to shake, a small shaking, involuntary, repetitive movement. It's most often seen in the hands, but you can see it in the whole arm, whole leg, the neck, the jaw. Some abbreviations here. AMS, my new color, is altered mental state. CVA is that cerebrovascular accident. TPA is tissue plasminogen activator. TIA is that ischemic attack. Transient. Transischemic. Transient. It's the same thing. BSE is bovine spongiform encephalopathy. Encephalopathy. CJD, that's an E. Creutzfeldt-Jacobs disease. So traumatic brain injuries, they cause damage to the brain. Coup is a blow to the skull. Countercoup is a rebound of the brain against the skull opposite the coup. A contusion refers to a bruised area within the brain. A concussion is a mild head injury. It's repeated concussions, like from boxing or football, that can have that cumulative effect. A concussion, people may feel like they're dazed, confused, loss of consciousness, and loss of mental ability. Shaken baby syndrome occurs when the baby is vigorously shaked, not like bouncing the baby to fall asleep. They're vigorously shake back and forth, causing damage to the brain and bones. Shaken baby syndrome usually occurs in children younger than 2 years of age. ADLs, activities of daily living. Shaken baby syndrome. E. Traumatic brain injury. Okay, disorders of the meninges. A subdural hematoma. Well, this should tell us it has to do something with blood. This tells us where it's at. So that subdural hematoma is that bleeding into that subdural space. Common causes of a subdural hematoma include closed head injuries from trauma or roller coaster rides with high-speed turns that jerk and whip the head. An epidural hematoma refers to pooling of blood in that epidural space. So outside of that brain. Epidural hematomas are usually caused by skull fractures. Meningitis is that inflammation of the meninges that covers the brain and the spinal cords. There's viral and there's bacterial meningitis. There are vaccines out to prevent many of the different causes of meningitis these days. They've been out for years, actually. Then meningioma is a tumor that originates in the arachnoid matter and is usually benign and slow growing. Bell's palsy. This is cranial nerve specifically. Bell's palsy has to do with cranial nerve 7. We usually write that cranial nerve, and we use Roman numerals. 7. This is characterized by sudden weakness or paralysis of muscles. It's usually on just one side of the face. So that one side of the face kind of droops down. Trigeminal neuralgia, cranial nerve 5, is extremely painful chronic disorder caused by a nerve injury or compression of the nerve by a blood vessel. Acoustic neuroma, cranial nerve 8, vestibulocochlear nerve, that it's a slow growing benign tumor on the vestibulocochlear nerve that's going to cause hearing loss, tinnitus, which is that ringing in the ears, and dizziness. So more than 6 million Americans are actually affected by this condition called fibromyalgia. We talked about it in the muscle chapter, pain in muscle fibers. 5 million are disabled by back pain, and 40 million suffer from chronic recurrent headaches. There are 3 levels of pain severity. We have mild, moderate, and severe. And treatment can be based on the 3 levels. So mild, we may use NSAIDs like ibuprofen. Moderate, we may use something like opioids. And then severe, we're going to use even higher doses of those opioids. I don't necessarily agree with these, but these are what your textbook says. Meningococcal meningitis. So meningio means meninges. Cock means round bacterium. All means pertaining to, so we're pertaining to the meningococcal bacterium that is giving meningitis. So meninge means meninges, then itis is that inflammation. Aesthetics. And without aesthetic, that means sensation. Ick means pertaining to, so an agent that causes absence of feeling or sensation. Fibro means fiber, muscle. Algia means pain. So we have pain in the muscle fibers. Now let's look at disorders of the spinal cord and peripheral nerves. So with the myelin sheath around nerve fibers, when that gets damaged, nerves do not conduct impulses normally. That can cause demyelination, or what that is demyelination, I should say, or destruction of an area of that myelin sheath that occurs in the peripheral nervous system and can be caused by inflammation, vitamins B10 deficiency, poisons, and some medications. Multiple sclerosis is the most common disorder which causes this demyelination. Again, it is autoimmune, so the immune system is attacking those myelin sheaths around that brain, spinal cord, and optic nerves. MS usually has an onset between 18 and 35 years old. We don't know what really brings it about, unfortunately. So let's look at some more words. Demyelination, myelin means myelin, so that process of losing myelin sheath of that nerve fiber. Intermittent, mit means to send, so alternately ceasing and beginning again. Paresthesia is esis. Thank you. This is sensation. So this is an abnormal sensation. Tickling, pricking, exacerbation, increase or aggravate. So the period when there is an increase in the severity of a disease. Remission, remiss, this means to send. So a period when there is a lessening or absence of the symptom of a disease. Then we have modify. In Latin means to limit. We notice, see here, mit and miss, they both mean to send. Modify can also mean to change in the form or quality of a thing. So trauma. Spinal cord. The spinal cord is injured in 3 ways. Severe, or it could be severed, cut off by a fractured vertebrae, contused, as in a sudden violent jolt to the spine, or compressed by a dislocated vertebrae, bleeding or swelling, or even one of those intervertebral discs that is pushing on that spinal cord. So when the spinal cord is injured, sometimes limbs become paralyzed. Both muscle control and sensation below the injury are lost. Partial paralysis is also called paresis. Compression of the cord can also occur from a tumor in that spine, in that cord or spine, or from a herniated or protruded disc, as I mentioned before. Syringomyela is fluid-filled cavities that grow in the spinal cord and compress nerves that detect pain and temperature. There is no specific cure. Acute transverse myelitis is a localized disorder of the spinal cord that blocks transmission of impulses up and down the spinal cord. Subacute combined degeneration of the spinal cord is due to a deficiency of B12. Poliomyelitis is an acute infectious disease caused by the poliovirus. Symptoms and signs of poliomyelitis are muscular paralysis, including paralysis of the muscles of breathing. Poliomyelitis can be prevented through vaccination and has been almost eradicated in the world. You can still find it in third world countries, but it has been eradicated from this country, which is why there is no polio vaccine in this country anymore. Post-polio syndrome occurs many years after recovery from polio. The symptoms and signs associated with post-polio syndrome are tired, painful, weak muscles. Amyotrophic lateral sclerosis, ALS, or Lou Gehrig's disease. These motor neurons are going to progressively degenerate. There's no cure for amyotrophic lateral sclerosis. It's a very sad disease to watch. I had a friend pass away from it, and we just watched it progress from the time when he was just constantly tripping till the time when he passed away about 18 months later. So ALS, that amyotrophic lateral sclerosis, MS, is that multiple sclerosis. Polio is that poliomyelitis. PPS, post polio syndrome. SCI, spinal cord injury. So the peripheral nerves, neuropathy. Neuropathy is used here as any disorder affecting one or more peripheral nerves. Mononeuropathy is damage to a single peripheral nerve. Some examples: carpal tunnel syndrome, which is a median nerve palsy at the wrist, which is compressed between the wrist bones and a strong overlying ligament, and it causes pain in that thumb area, and eventually, if it's not treated, it can cause muscle wasting. Ulnar nerve palsy results from damage to the ulnar nerve as it crosses over the surface of the humerus at the back of the elbow. Your funny bone nerve, it's your ulnar nerve. Peroneal nerve palsy, which arises from nerve damage as the peroneal nerve passes close to the surface near the back of the knee. Compression of the nerve occurs in people who are bedridden or strapped in a wheelchair. Polyneuropathy is damage to and is simultaneous malfunction of many. That poly means many, motor and or sensory peripheral nerves throughout the body. Then herpes zoster, which is like shingles. It's that infection with that chickenpox virus, that varicella, that arises from a reactivation of that dormant primary virus from that chickenpox, and it's usually unilateral, and it usually follows that nerve as it kind of wraps itself around the body. Okay. Hernia, herniate, and herniation all have to do with the anatomical structure protruding from its normal location. Hernia and herniation are nouns describing the disorder, and herniate is that verb. Paralysis, paralytic, and paralyze all have to do with the voluntary control of a structure. Paralysis is the noun, paralytic is the adjective, paralyze is the verb. Paresis is a partial paralysis or weakness, while hemiparesis, hemi means half, so it's paralysis of one side of the body. Congenital means born with or present at birth. Gestation refers to pregnancy, so most congenital anomalies of the nervous system occur during the first 10 weeks of gestation. That's why that first trimester is most sensitive. Ultrasonography and amniocentesis are used to diagnose congenital anomalies of the nervous system. Teratogen is a word used to refer to an agent that can cause malformation of an embryo and a fetus. Alcohol, x-rays. Good examples of teratogens. most drugs, like, so encephalopathy occurs when a fetus does not develop cerebral hemispheres and is incompatible with life. So this they cannot survive. Microcephaly, microcephaly is associated with the small cerebral hemispheres and a decreased head size. Hydrocephalus is characterized by an enlarged cerebral ventricles with excessive cerebral spinal fluid and increased head size. Spina bifida occurs in the lumbar and sacral regions of the spinal cord. Spina bifida occurs when there is a malformation of that vertebral arch, so that back of that vertebrae, with associated spinal cord changes. Spina bifida cystica is an absence of those vertebral arches, so the whole back of that vertebrae is missing, which causes the meninges and spinal cord to protrude. We don't know what necessarily causes spina bifida, but it may be prevented by females in taking enough folic acid before and early in pregnancy. Fetal alcohol syndrome is the third most common cause of mental retardation in newborns and occurs when a pregnant woman drinks alcohol, especially in those first few weeks of gestation. Alcohol gets into that amniotic fluid, and it sits in there. So that growing and developing fetus, embryo the first 8 weeks, fetus from after 8 weeks on, is sitting in that alcohol. Cerebral palsy classification. Cerebral palsy is a term used to describe the motor impairment resulting from brain damage in an infant or young child, regardless of the cause or the effect on the child. It is usually associated with delay in the normal milestones of infancy and childhood. Monoplasia involves one limb. It's usually an arm. This is a classification of cerebral palsy by how many limbs are involved. Paraplegia has to do with both legs. Quadriplegia is all 4 limbs, both arms, both legs. Hemiplegia is on one side, that arm and leg on the same side of the body. So let's look at these words. An, without, cephal, or cepha, which means brain. Ali means condition. So born without cerebral hemispheres, born without a brain. Hydrocephalus, hydro means water. Cephal means head. Us means pertaining to. Meningocoele. Meningio is that combining form for meninges. Cele means hernia. So let's break these words down. Whoops, that's not what I wanted. Hemi means half. Paresis means weakness. So weakness in either the right or the left side of the body. Again, hemi is going to mean half. Leg means paralysis, and IA is condition. So a condition of being paralyzed on either the right or the left side of the body. Hemiparesis and hemiparalysis can both be effects of a stroke or cerebral palsy. Ataxia is the inability to coordinate muscle activity leading to jerky movements. That adjective form for ataxia is ataxic, which means pertaining to. Athetosis means slow. Withering involuntary movements. Athetoid means resembling. That O-I-D here means resembling. Makes it that adjective. Spasm is a sudden involuntary contraction of a muscle group, and that adjective form is spastic, where that ick means pertaining to. So let's look at some different diagnoses and procedures to diagnose. First, we have a lumbar puncture or spinal tap. This is performed to remove that cerebral spinal fluid for analysis. Electroencephalography records the electrical activities of the brain to diagnose seizure disorders, sleep disturbances, and brain damage. Computed tomography generates images of slices, that's a CT. This is the same thing as a CT, computed tomography. Those slices of the brain to diagnose brain tumors, ischemia, and birth defects. Magnetic resonance imaging, MRI, generates highly detailed pictures of the brain and spine to diagnose strokes, tumors, myelin sheath damage, and it does not expose the patient to radiation. So magnetic resonance angiography is going to use dyes. So they're going to produce these detailed images of blood vessels in the head and neck. Cerebral angiography is going to use dyes to produce images of the blood vessels that are blocked or have aneurysms or malformations. Colored Doppler ultrasonography uses ultrasound to diagnose transischemic attacks and the risk of strokes. Echoencephalography is going to use ultrasounds to produce images of the brain in children under the age of 2. Positron emission tomography involves attaching radioactive molecules to a substance necessary for brain function like glucose. Myelography uses a dye with X-rays of the spinal cord to diagnose spinal cord disorders. Evoked responses are when sensory stimuli are used to activate and evaluate brain functions. Electromyography provides information regarding disorders of the muscles, peripheral nerves, and neuromuscular junction. Nerve conduction studies measure the speed at which nerves conduct impulses to and from the brain. CSF, cerebral spinal fluid. Computed tomography, CTS, is carpal tunnel syndrome. EEG is that electroencephalography. FAS, fetal alcohol syndrome. MRI, that magnetic resonance imaging. PET, positron emission tomography. Craniotomy. This is it's a surgery to remove part of the skull bone, like a they make a bone flap to expose the brain for surgery. Deep brain stimulation is a surgical placement of electrodes deep into specific areas of the brain to deliver electrical stimulations to treat the tremors of Parkinson's disease, essential tremors, and multiple sclerosis. Endoscopic pituitary surgery uses an approach through the inside of the nose to remove pituitary tumors. Endovascular coiling blocks the blood flow to an aneurysm. Flow diversion uses stents placed via a catheter to maintain blood flow through a blood vessel where blockage or an aneurysm has occurred. Carotid endarterectomy, where they work with that carotid artery in the neck. They could go through that carotid artery, put stents in there to help move things along. So different types of pharmacological agents for the nervous system, where you can use stimulants. Stimulants stimulate the nervous system to cause the release of dopamine, which leads to pleasurable effects. Stimulants include coffee or caffeine, not just coffee, caffeine in general, nicotine, amphetamines, and cocaine. Sedatives are quiet. They quiet that nervous excitement and they help to induce sleep. Sedatives include alcohol, barbiturates, meprobamate. Inhaled anesthetics are more powerful than sedatives, but act similarly. Opioids depress sensory nerve pathways to reduce pain and depress areas of the brain to control coughing, breathing, and intestinal mobility. Opioids include morphine, codeine, heroin, methadone, and oxycodone. We also have opioid antagonists. They prevent opioid actions and are used in drug overdoses like naloxone or naltrexone. We also have tranquilizers. They act like a sedative, but do not induce sleep, like Librium, Valium, Xanax. Antidepressants increase the amount of serotonin at the synapses, like Zoloft or Prozac. Anti-epileptics prevent stimuli from passing across the synapse, like phenytoin and Tegretol. Psychedelics, like ecstasy, angel dust, and acid. And marijuana produces a drowsiness of sedatives, the pain dulling effect of opioids, and in high doses, the perception of distortions of psychedelics. LSD is going to mean lysergic acid AMIDE, lysergic acid dithymolide, or acid. That's the better word for it, because that's what most people know. MDMA, methyl N XYMETHAMPHETAMINE, or ecstasy. PCP is pencyclidine or angel dust. And then THC, tetrahydrocannabinol, or this is the active ingredient in marijuana. So let's go into some mental health. Mental health is defined as the emotional, behavioral, and social well-being that enables an individual to cope with internal and external events. Psychology is the scientific study of behavior, talking, reading, sleeping, interacting with others, and mental processes, thinking, feeling, remembering, and dreaming. Psychiatry is that medical specialty concerned with the origin, diagnosis, prevention, and treatment of mental, emotional, and behavioral disorders. Major depression, also called unipolar disorder, occurs when a person is so deeply sad for at least 2 weeks that he or she feels hopeless, sees nothing but sorrow and despair in the future, and may not want to live anymore. And then there's bipolar disorder, which is also, your book says used to, it still is, called manic depressive disorder. This is the alternation of episodes of major depression with excessive overexcitement and impulsive behavior known as that mania. Psychosis is a disorder causing mental disruption and loss of contact with reality. Schizophrenia is a form of psychosis in which there is a loss of contact with reality. People with schizophrenia do not have a split personality, but their worlds are separate from the meaning. Their perceptions are separate from reality, and their behaviors are separate from their thought processes. They perceive things without a stimulus, like a hallucination. They suffer from delusions, mistaken beliefs that they are contrary to facts. The delusions can be paranoid with pervasive distrust and super suspicion of others, and their speech is disorganized and can be incoherent, or they may refuse or be unable to speak. Mute. Anxiety disorders are characterized by unreasonable anxiety or fear that is so intense and chronic that it disrupts the person's daily life. Generalized anxiety disorder, GAD, consists of unreasonable anxiety that is not focused on one particular situation or event. Post-traumatic stress disorder arises after significant trauma, such as a life-threatening incident, loss of a loved one, abuse, or combat in a war. Panic disorder is characterized by sudden, brief attacks of intense fear. Phobias. Phobias differ from generalized anxiety and panic attacks in that a specific situation or object brings on the strong fear response, like claustrophobia, fear of being trapped in a confined space, acrophobia, fear of heights, agoraphobia, the fear of crowded places. Obsessive compulsive disorder. Patients have both obsessions and compulsions. Obsessions are recurrent thoughts, fears, doubts, images, and impulses, while the compulsions are recurrent, irresistible actions such as counting or checking, like turning the lock on your door 4 times back and forth to make sure your door is really locked. Washing your hands 5 times to make sure your hands are really clean. So psychiatry is the diagnosis and treatment of mental disorders, while psychology is the science concerned with the behavior of the human mind. Psychosis is a disorder causing mental disruption and loss of contact with reality, while sociopath is a person with antisocial personality disorder. A delusion is fixed, unyielding false belief held despite strong evidence to the contrary, while paranoia is the presence of persecutory delusions. Mania is a mood disorder with hyperactivity, irritability, and rapid speech, while a phobia is a pathologic fear or dread. Let's look at some of these abbreviations for these words we've been talking about. GAD, general anxiety disorder. MAP, multiple personality disorder. OCD, obsessive compulsive disorder. PTSD is post-traumatic stress disorder. So the nervous system communicates with trillions of cells in the body to allow you to function. It allows you to sense what is happening around you, as well as allows you to move around. There are many disorders of the nervous system, from the brain to the cranial nerves, the spinal cord, the meninges, the peripheral nerves. And there's a lot of mental health issues that deal with the specific, with the brain and the body. It is important to identify these different mental health issues, and so you can refer people to the correct mental health people if necessary. Thank you very much for listening, and have a wonderful day.